Medical clinic in Boise aims to get seniors the care many say they have a hard time finding.
Keystone Center for Geriatrics runs some of the only independent medical clinics for the elderly in the state. Today, it opened its third location. That's where Abby Davis found out they do need the extra space right now.
Brian, one of Keystone's geriatricians, says they reached capacity at their Meridian and Eagle locations. They'll be able to help hundreds of more people in this new space. Cheers. In what looks like a traditional home, one company is taking a non-traditional approach to caring for seniors.
The home-like environment really facilitates a certain humanity.
Keystone Center for Geriatrics' third location in the Treasure Valley officially opened Thursday in Boise.
Yeah, we need more healthcare in Idaho.
Absolutely.
Creating another place its providers, including Megan Dene, can help people 65 and older.
Or people who struggle with geriatric syndromes, things like cognitive impairment, recurrent falls, complex osteoporosis or bone health concerns, urinary incontinence, and functional status impairments.
Dene says there aren't a lot of options for Idahoans with these diagnoses aside from hospitals like St. Alphonsus or St. Luke's.
In terms of outpatient geriatric practice, we're it.
My mother had Alzheimer's, my grandmother had Alzheimer's.
Jen Ewer is one of Dene's patients.
I really wanted a doctor who would be able to recognize early onset or the early symptoms.
But she says it wasn't easy to find a provider.
I had a great primary care physician who retired. And so I was looking for someone to help me, and I wasn't able to find anyone other than Megan.
Finding primary care can be really tricky and complicated because there's just not enough providers in general, and certainly not enough providers who are able to take Medicare at a regular sort of rate. Bye, Jenny. Thank you so much.
Jenny Lingle works for Co-Imagine Health, a nonprofit trying to improve health care across the region. She says Idaho's, quote, fragmented system is also part of the issue.
I'm having to go to so many different places to get your needs met.
She says clinics specializing in just geriatrics are so important.
As our population ages, I think it's going to become more and more of a need.
We're happy to sort of be an alternative for these folks and provide, as timely access as we can.
Keystone takes most insurances, including Medicare and Medicaid. Dene says there are great training programs in Idaho for people wanting to work in geriatrics, a big reason why she's hopeful, Morgan and Brian, that more people will work in the field in the future to meet that need.
All right, Abby, thank you.